What if I told you there was a toxin floating around right now in your body that you also needed to survive? This toxin must remain within a certain range. Too low and your body has no energy to fuel the cells. Too high and you become very sick, leading to an increased risk of heart attack, stroke, or even loss of your legs. I'm Dr. Adam Goodcoff, and welcome to Your Health Explained. So what's so bad about all this sugar? It comes with a term known as glycation. Glycation is a fancy science word for sugar getting stuck on everything. If you spill Coca-Cola on your table right now and let it sit there, what would happen? You've likely seen this before, a sticky dark mess left behind. Your red blood cells are no different. As the glucose levels rise, the cells are essentially floating around in sugar. They even begin to stick together and, in many cases, have trouble functioning like they should. At this point, you're probably wondering, how do I know if I have diabetes? Well, if we were in 250 BC, then the physicians and scholars of that time would have to taste your urine. Yep, you heard me right. Doctors used to drink their patients' urine. So, out of respect for all of the doctors that had to drink urine in the past, be sure to give this video a thumbs up and subscribe because that was just unfortunate for them. Now, why on earth would they taste urine? Well, the physiology is complicated, but essentially, the kidney can only filter a certain amount of sugar. Once the level of sugar reaches a certain critical value, it overwhelms the ability of the kidney to reabsorb any of that sugar. When the filter is overwhelmed, just like filling a funnel too fast, the sugar spills past the filter and into the urine. Now, obviously, you don't see doctors tasting urine. And while we can run a test to look for glucose in the urine, it's not the primary test for diabetes. No, that has instead become a blood test, and likely not the blood test you're thinking. You might be thinking that we check the blood for a sample to see what the sugar level is. And while we can do this, we have an even better test. You see, if I took your blood right now and you had just consumed a soda and a piece of cake, you could imagine that your blood glucose level would be quite high. Even a healthy CrossFit athlete would have a high glucose at that point in time. However, insulin would already be released, and within minutes, that level would descend back to normal and begin to be stored for energy later. That goes to say that the level of glucose in the blood is a right now measurement, a slice in time. It can't tell what's been happening before in the last days or even weeks. But what if I told you there was a test that could? Remember that term glycation? Well, a bunch of smart scientists came up with a blood test using that principle. Essentially, they looked at red blood cells to figure out how much of that sticky sugar was actually stuck onto the cells floating around. Since the average red blood cell lasts approximately 120 days, this meant that you could have a 120-day rolling average of what the blood sugar condition was like in the body. This test became known as Hemoglobin A1C, or an A1C for short. It has become the most often used test to check how well a diabetic is managing their sugar levels. Values less than 6.5 are normal, while values greater than 7 are indicative of diabetes. The higher the number gets, the more at risk you are for strokes, heart attacks, and limb loss. If you enjoyed today's video and found it educational, please consider giving this video a thumbs up. Don't forget to subscribe to have your health explained.